Every day you write in with your most intimate and sometimes even embarrassing medical questions. But guess what? We've got you covered. It's time to ask the doctors. And this first question comes via Instagram. I currently take antidepressants. Will I need to be on these forever? Is it dangerous to stop taking an antidepressant right away? Such an important question. To help us answer it via Skype is board-certified psychiatrist Dr. Domenick Sportelli. Doc, welcome back. Let's address this idea first off, if you start an antidepressant, being on it forever. Can you address that?
Think about this. 16 million people have major depressive disorder, and 1 in 8 people are on an antidepressant. And often when I put someone on an antidepressant, they go, oh my God, doc, I don't want to be on this medicine forever. Is that the case? So such a relevant question and such a common question. Yeah. So my answer is a very vague, it depends. And I know that's not what you want to hear, but I'm going to break it down for you. I'm going to clear it up because the most important thing is an educated patient. So this is how we approach antidepressants. If someone is diagnosed with depression and they had a severe major depressive episode, we do what's called an acute phase treatment. What that basically means is we start an antidepressant and we titrate up, we increase the dose until it gets to a therapeutic level, and that takes about 4 to 8 weeks. Once someone has remission, that's the goal, is to alleviate the depressive symptoms, then we go on to what's called the continuation phase. And the continuation phase is basically just to make sure the person doesn't relapse. Now, this is where the time comes into play. If someone has one major depressive episode in their life, and they've never been suicidal, they've never been self-injurious, we recommend about 4 months to 9 months of treatment before thinking about stopping. And then you can stop, you just have to taper off very slowly. If someone has ever been suicidal or so depressed that they've been self-injurious, or they've had more than 3 major depressive episodes in their life, you may have to go on to what's called continuation treatment, which is longer term. It could be another 6 months, it could be another year, it could be indefinitely.
So Dr. Sportelli, are these medications addictive?
By definition, they are not addictive, meaning there's no withdrawal and you don't develop a tolerance. However, if you just stop, suddenly cold turkey stop an SSRI, you tend to feel pretty bad. We call that SSRI discontinuation syndrome.
And the SSRI is the antidepressants we've been referring to.
Yeah, exactly. It's like an antidepressant discontinuation syndrome. So if someone wants to stop an SSRI or an antidepressant, my recommendation is, first and foremost, talk to your doctor, because you got to figure out why you want to get off. Let's make sure you're okay to get off. Now, if you're going to get off, you just want to taper slow. And this may take 4 to 6 weeks by cutting the medicine little by little, and that can completely avoid any of this discontinuation syndrome.
So like everything else, Dr. Sportelli, everyone is a little bit different, right? In medicine, every patient has a different issue, a different history, different needs. I mean, not atypical that we all have a short-term depressive episode, totally different than what you're describing, right?
Absolutely, and major depressive disorder is a very serious thing. Like I said, 16 million people suffer from it, and 10 million of those 16 million have it so bad that they can't function, they can't go to work, and they can't, be with their families and do things. And that's severe depression, and that's what we're treating.
And I do think it's worth noting for our viewers that the newer antidepressants, these SSRIs, are so much safer than some of the old school tricyclic antidepressants that I know back when I was doing my training, you're still worried about a lot, some of the potential side effects. So I guess what I was just going to say before we go, Dr. Sportelli, is if someone does need to be on these long-term, potentially the rest of their life, the good news is that that's okay. Is that fair to say? Meaning you get on a regimen, it works for you, you're in remission. These medicines, by and large, are very safe.
Yeah, Trav, I got to tell you, the newer antidepressants came out in about the 1980s, and I have patients that I know have been on some of these since that time, and they're doing just fine, and there's no problems, and they're living their life wonderfully, and they're not having side effects. So if you find the right medicine in a newer antidepressant, it could literally change your life for the better, and it's okay.